Today, I'd like to share with you how we can use adaptive thinking in higher education to attract and retain students that have experienced foster care, known as foster care alumni. Although the scenarios are real, I will use a fictitious school, Walker University, while describing the dilemma, my analysis, and effective intervention, and both challenges and strategies to address these challenges within an adaptive leadership framework. Youth who spend time in foster care aspire to attend and complete college at the same rate as their non-foster care peers. However, only 3% of foster care alumni will earn a higher education degree in comparison to nearly 47% of students who have not experienced time in the foster care system. Why is there this discrepancy? Well, foster care alumni face unique challenges while working to attain a degree that, without support, often results in dropping out of college. For example, foster care alumni often experience disruptions in K-12 schooling that undermine their academic achievement and college readiness. Many also struggle with social, emotional, and behavioral health issues, yet receive no or poor quality services to address these needs. Finally, foster care alumni often lack financial, material, and emotional supports, which are critically important for young adults seeking a college degree. So, how can Walker University attract and support foster care alumni? And even more specifically, how can Walker University support the needs of foster care alumni so they choose Walker U as the place to pursue higher education? If we use a technical lens to look at the types of support that foster care alumni often need, this seems to be a fairly easy dilemma to solve. For example, foster care alumni may need academic support, which is actually available to all students through the Academic Enrichment and Support Center. Foster care alumni often also have difficulty accessing quality health care. Well, each student at Walker University has a personalized health portal, access to appointments on campus with a registered nurse or nurse practitioner, and even the option to receive individualized counseling. To meet financial needs, the state of Minnesota, where Walker University is located, offers the Fostering Independence Higher Education Grant, which provides college tuition, fees, books, housing, and transportation for students under age 27 who were in the state's foster care system at any time after age 13, and it's available to be used for both private and public higher education institutions. Additionally, many material needs are met through on-campus housing and the dining center. Emotional needs are addressed with a variety of student life activities. So the problem, how to provide support for foster care alumni so they choose Walker University, seems to be clear-cut with an equally conclusive solution that says nothing new needs to be created. The support desired is already in place. Most, if not all, higher education institutions offer similar supports: academic, health, physical, emotional, and yet the rate of completion for foster care alumni is a dismal 3%. So what's missing? Well, when considering this same challenge through an adaptive lens, the ways to address hardships foster care alumni face when it comes to enrolling and staying in college are not as apparent. Although there are current services that exist, will students who have experienced foster care know how to access them? Has access to these resources been designed with a mindset that some students may have a difficult time with transportation, internet, and stability? Are staff prepared to help students who may have inconsistent housing or face hunger? Are faculty willing to work with students who have gaps in previous learning from unpredictable circumstances during childhood? And what additional support do students who are foster care alumni need to successfully earn a higher education degree? Along with asking these important key questions, an adaptive approach requires taking a balcony-level view, which means taking time to observe what is currently happening when foster care alumni attend or consider attending Walker University. Through this observation, it becomes clear that although there are existing services to address the perceived needs, the challenge to attract and retain students who have experienced foster care remains. Before jumping into action, we need to interpret or hypothesize why this is the case. One possible explanation is that access to these services is unknown, limited, or known but unreachable. A second possible explanation is that foster care alumni know about and attempt to utilize these services, but get stuck trying to understand which service to reach out to and when. A third hypothesis is that they know these services exist, but would rather struggle independently than be perceived as asking for help. So, what's an effective intervention to consider implementing? Well, one idea is to develop and implement a program that helps to fill these gaps, a centralized point or point person that helps foster care alumni navigate the services available to them that will increase the likelihood of their success in college. Well, considering whether or not implementing a program specific to supporting foster care alumni might be an effective intervention to recruit and maintain this particular group of students at Walker University, it's important for leadership to talk with and listen to external stakeholders. Faculty, staff, and foster care alumni should have an opportunity to speak into the conversation of possible solutions. One way to do this will be to intentionally invite all who may be interested to a monthly gathering with a guest speaker who addresses topics important to foster care alumni and moving into adulthood successfully. Leadership also needs to acknowledge the sense of loss that may be felt if this intervention is to be created and implemented. Processes, personnel, and environments that have been in place for a long time will likely all feel some effect if a singular point is created for support services for foster care alumni. An adaptive view requires conversations about how to keep the best of what currently exists while moving forward with innovative and new ideas. Finally, framing the intervention as a program that aligns directly with the mission of Walker University, which is to remove barriers to higher education for marginalized communities, that this provides the opportunity for stakeholders to connect emotionally and become allies of moving this initiative forward. The creation and implementation of a program to support the unique needs of foster care alumni takes a multifaceted and complicated system of services and provides a single source, comprehensive, relationship-based organization to help students who have experienced foster care navigate college from initial inquiries to application and enrollment through course selection, academics, and social, emotional, and financial support that's available for them. In fact, California State University in Fullerton implemented a similar intervention in 1998 named Guardian Scholars. In the years since its inception, foster care alumni who participate in this program have an astounding graduation rate of over 97%. As Walker University seeks to increase enrollment, retention, and graduation rates, implementing support specific to foster care alumni is one idea that is important to explore. Even with clear and virtuous intentions, thorough communication with all stakeholders, and adaptive planning, implementing a program to support foster care alumni will require time, reflection, and integrity. Leadership will need to have flexible mindsets and remain willing to listen to those who embrace the program as their own. Walker University will need to monitor and adjust, to remain curious and courageous. Doing so will draw students with foster care experience to apply for, attend, to graduate with pride from an institution committed to removing barriers to higher education for marginalized communities and making a difference that will last a lifetime.